Hello and welcome back again to this channel where we talk about the basic medical information making a difference. It has been a while since I did a video. We thank God for this fire. The last time we were talking about acid reflux, and today we are going to see whether acid reflux affect babies. My name is Rebecca Morangi, returning subscriber. Thank you so much for always checking on this channel, and for those who have come across this channel for the first time, kindly consider to subscribe. Have you ever thought how difficult it is when your baby can't use words to explain how they are feeling? Acid reflux, this is when the stomach content from your baby flows back to the esophagus. This can lead to spitting or vomiting. Spitting, this is when the stomach content flows back easily and it's harmless. But when we mention vomiting, this is when there is muscle contractions. The baby sometimes feels very uncomfortable and ends up crying. Why does this condition happen? The condition happens because the digestive system of the baby is not fully mature. Does it go away? Yes, it does, especially before the first birthday of your baby. Does it have any disadvantage? There are some symptoms which come alongside. Sometimes we call them troublesome symptoms. One is when your baby cannot actually have the weight which is needed. Reason being, your baby cannot be able to take in the required amount of nutrients. And sometimes when you have or your baby has acid reflux, it can lead to what we call chronic cough. So we can as well associate some chronic coughs with acidity. And these coughs or this acid reflux in babies can happen because of the foods we give them, depending on their age gap. Babies can have this acid reflux or they can spit. I believe at this point you have the difference between spitting and vomiting. Now, your baby can spit several times a day and it doesn't have any problem, or it doesn't harm your baby. Sometimes we call these babies happy spitters. Acid reflux, or what we call gastroesophageal reflux, this is what we call sometimes heartburn and indigestion. It happens to babies and even adults. We have gastroesophageal reflux disease. This is a chronic condition which can affect the quality of your baby's life because it damages the esophagus. Most of the time we look for pediatricians who will examine the baby, because at the end of the day your baby will need treatment where medication will be used. So the pediatrician will use the baby symptoms to rule out whether your baby has what we call gastroesophageal reflux or what we call GERD, where treatment will be needed by the use of medication. As we get moving, we'll get to see more on this acid reflux, and we get to understand how this condition can be managed at home before you even get to see a specialist. Thank you so much for always checking on this channel, because I believe up to this level you have gotten something. You have learned that acid reflux can affect young babies. This condition can go away before the first birthday of your baby. It has some disadvantages because some babies have what you call poor weight gain because they are not able to absorb nutrients which are needed for them to grow. And then sometimes it leads to chronic cough. There are those who vomit, and then you find that in the vomit there is some blood, what we call troublesome symptoms, which leads us to look for specialists to diagnose either your baby has what we call gastroesophageal reflux or gastroesophageal reflux disease. So it's very difficult for your baby to explain this because they can't use words to explain how they are feeling. Thank you so much. If today is your first time to come across this channel, kindly subscribe. Don't forget to subscribe. Bye bye.